I was determined I wouldn't do a PhD because the attitude to graduate nurses was, oh well, they'll just go off and do research and they'll be no use to anybody. So I said, I'm going to work in practice. I'm going to be. So I remember distinctly working in medical and surgical units, and I just kept thinking, why am I doing this? Why aren't I doing this? And it was actually the cognitive and behavioural dissonance that I was experiencing as a registered nurse that I thought, I'm going to have to do something, or I'm going to leave nursing. I'm going to have to change the way that we deliver care. So it was actually trying to understand what I could do to actually change the system to make it more patient-focused, more equitable, and actually provide better outcomes. So, and I'm still trying to do that, Helen, unfortunately.
Other questions? Yep. Steve.
It was interesting, and any of you can answer this question, but all three of you talked about other places, travel. So really I'm interested in anyone's comment on the importance of travel. I mean, Roger, your experience in Papua New Guinea obviously started you on this track, and Justine went all over the world, and Alison came from Northern Ireland and went everywhere and then ended up in Adelaide. So, I mean, one of the things I found most exciting about a clinical research career was the people and the travel, the people you meet and the places you go, and yeah, just interested in your thoughts on that.
Okay, first, well, I think that you just get a new perspective, don't you? And you see and understand things that you never even dreamed existed, and you bring that back home, which is good. Mind you, Tasmania's home. I'm not Australian. I'm Tasmania. I want to emphasise that. I'm travelling at the moment, really. But also, I think afterwards when you're travelling, it's always fascinating to talk to people at meetings. These ideas just drop out of the sky. You're at a meeting and somebody says, this is a really stupid question, and a hole opens in front of you. So I think it just broadens your knowledge base. I learn things in third world countries from the way they do things.
I mean, I think Roger's probably said it all, but just people really do think about things differently in different parts of the world. It's hard to appreciate that until you are somewhere else, and you're presented with something that you would never, you would have done it a particular way, and what, they're doing it like that? How did they ever decide to, well, maybe that might be a good way, and then you just pick it up. So I do think it's hard to appreciate until you're actually in that situation, but it really does offer you important new perspectives.
And I'll sort of just tell you, Everett Rogers, who was the guy who wrote Diffusion of Innovations many years ago, he actually studied Midwestern farmers and to try and understand how they introduced new innovations into their farming practices, and he found that the ones that did were the ones who went to the markets, talked to each other, learnt new ideas and then brought them home. So I think this is a very deep sort of requirement for us in order to be innovators. You have to get out, you have to move, shift, talk to people, and then reflect, and then change what you do yourself. So I think all three of us reflect that sort of curiosity-driven journeying.
I would say that you also have to have tremendous respect for the people that you're with. And if we're in Myanmar, I have just insulted you all by crossing my foot and pointing my foot towards you. That's a deadly insult. So you have to really be aware of local nuances, because if you're perceived as a rude Westerner, you're going to get nowhere. But it's fascinating. I've done work on herbal medicine, and I was presenting it in Hong Kong and Kunming, and I said, here's an example of Western arrogance. A Westerner telling you what the problems are. And they came up to me afterwards and said, it's amazing, we haven't thought of this. So if you label yourself as an arrogant idiot, people actually tend to accept it for some reason.
Jenny.
Thanks, Maria. Alison, 2 questions. From a nursing perspective and being an old bureaucrat, how does the system change to grow clinical researchers within nursing because not everybody can travel or move house from one country to another. And my second question is, I too am interested in change and evidence-based nursing practice in particular. How do you get change at scale? And again, what does the system need to do to respond, to enable change at scale rather than in pockets?
So South Australia produces probably about 1,000 nursing graduates a year. What I would do would be to identify the top 10% of that cohort graduating each year, to put them on a mixed TPPP and honours programme and have them mentored by people like Euron and people in the system who understand research, and then create a career pathway for them, early career, mid-career. It's relatively, I was going to say relatively easy to do. It just takes the will and determination. There are some good models in Alberg and in Toronto that I've seen where each department, each clinical department has its own nursing or allied health postdoc, PhD students, and if, as they're growing up, they're chairs, they're professors. So there is a major strategic initiative. How you get scale is you actually connect implementation of evidence-based practice into continuous quality improvement methodology in your hospitals. And and this is what we've been doing in Flinders with the oral care and reducing delirium projects, where teams of people experience the improvement. They're facilitated to do it, and then you start to slowly move it to different areas using your facilitators and champions. But I would say that my experience is that it probably takes 2 years to get significant improvement and embedded in a unit, in a ward. It'll take another 2 years for it to move across, and then that depends on your leadership. So you're really talking about 5 years in my view, and if we could speed it up, I would be very happy. But at the minute, that's how long it would take. Dedicated commitment, and Jenny, as well as I do, the mandate for executive directors of nursing and midwifery is they have to get this done in 6 months, and we waste so much money by doing stuff that is so complex, and we have to deliver it, and it would be much better if we could say, well, we deliver this tiny bit, and then we'll know that people will trust us and believe that this is what we can do.
While we're waiting for some other questions, you all alluded to the fact that you had to overcome certain challenges. It'd be great to tell us a little bit more about what helped you overcome those challenges and what was important in overcoming challenges and actually starting to thrive.
Alison's point about joint appointments, I think, is important. The last academic forensic pathologist died in 1898, and so forensics is a very, British-based forensics is very anti-research. It's said to be not part of forensic practice. Forensic practice is, going into court and, pontificating, whereas I think the research is so vital, and overcoming that was very difficult. But
what kept you going, Roger?
I think it's just, how can you not? I mean, it's fascinating. If you're not asking a question, you might as well go out and sleep with the dog in the sun. Really, I mean, you've got to ask questions, you've got to think about things. Why is this happening? The simplest case in forensics, 60-year-old man mowing a lawn, clutches his chest, falls down. Your hypothesis is that it's ischemic heart disease, but maybe it's not. If it is ischemic heart disease, why did he die today and not last week? Why did he die, whereas mine's actually worse? So there's just so many questions.
So, I mean, I alluded to it in my final slide, but my advice would be is that if you want to pursue this career and you don't know how, you find some role models who will act as mentors to help you out, and that would apply absolutely for me. I was very fortunate with the people who picked me up along the way and directed me. So that would be my advice to all the budding clinician scientists in the room.
And I think it was my naivety that, and it was, Roger, you mentioned that. I just didn't think it wouldn't happen, and I just thought, yeah, I have to do this. This is what I have to do. And you know, I went from Northern Ireland, headhunted to a role in the Royal College of Nursing, walked in, the one person I knew in the organisation who had, you know, brought me over to London, he said, oh, by the way, Alison, welcome, but I'm leaving in 3 weeks' time. And I'm thinking, oh, and I don't know anybody in London. And I thought, I'm going to have to just do this myself. So I learned some really important skills, but I picked up some really bad habits, which was I didn't search for my mentors. And I thought I had to do it all by myself. And that's not a good thing to think.
I think if you're looking for a mentor, get into Google Scholar, get somebody that's actually producing stuff and meet with them. My first mentor in research, he said his aim was to have his students do better than him. And I think that's a really good philosophy. I had one of my students presenting at a meeting in Sydney, and somebody was behind me and leant forward and said, stop looking like a proud father.
Great question.
Thank you everyone for the presentation. It was absolutely inspiring. My question really, I think anyone can answer this, is how do you balance going from clinical training to research and getting an introduction into sort of that research career, into joint appointments, if possible, but while we are waiting for joint appointments, how do we sort of stagger that? Do you do part-time research or clinic? And in your experience, how do we keep that practical? It purely in terms of sort of even in terms of finances, for example, patient income is one side of the story where you have to live and pay your bills, but how do you then start doing research without compromising too much of that?
Well,
Work 26 hours a day.
I do think it's easier than it was. Now in most of the clinical training programs, research is a requirement. So, you know, you've got your regular job, but you're given some time and expected to spend some time doing some research. So I think, and Alison can talk to allied health, but certainly in medical disciplines, that sort of is very standard. And then I suppose if research is for you and you're going to be a clinician scientist, by that time I would hope that you'd identified a mentor, somebody who's going to, or supervisor, if you're going to go on to a higher degree, then that mentor should be, or supervisor would be working with you to look at scholarships. So, for example, I've got a young clinician scientist at the moment. She's just finishing her training. She wants to do a PhD. She spoke to me some months ago, and we've already started putting in applications for scholarships, because you're right, you absolutely cannot do a higher degree without some sort of support. You have to have a scholarship. So, you know, that's again where I said you've got to go find people to supervise you, look after you, mentor you. That's again where the mentor can help out. And then once you're in your training program, many supervisors also, whether they're clinicians or not, would link you into the clinic wherever you're studying to start doing a little bit of clinical work along the way too. So when I was a full-time PhD student, Doug Costa, who you saw on my slide, was Professor of Ophthalmology where I was doing my PhD, and he organised for me to do a clinic every second week. So, you know, these sorts of opportunities come up if you pick the right supervisors and put yourself in the right spot. But Alison may have some comments about allied health.
So we have a couple of experiments going in at FMC where we've got 2 PhD scholarships, and these are clinicians who are funded 3 ways, so they don't have to compromise, you know, their salary, but equally they can spend time to do their PhD. So we're trying to develop a pipeline that will enable people to get an honours degree quickly, have some sort of joint appointment to do masters, and then be sponsored to do a PhD. So all of this needs the policy will, and again, going back to Jenny's question about how do we actually build the capacity in our nursing and allied health and midwifery groups. It's similar to clinical medicine, but there are, we just have to sit around the table and think about it. And the more questions we get from young aspiring academics, clinical academics like yourself, then you will hold us to account. So good on you.
Another question
I was just going to say, I think also you've got to find the right area. I mean, I moved right through, I did psychiatry and surgery, and then pathology. Suddenly I found myself at 1 o'clock in the morning writing out research and enjoying it, not thinking, oh, this is drudgery. It was just, it was wonderful, and if I had a free day of the weekend, I thought, I could do some work, so if they're paying you for doing something you love, then, you win.
This is like follow-up questions to all speakers. So, like if being a clinician researcher, you probably got a full-time job and like a part-time research sometimes. So, how would you find a common ground between a clinician researcher and your family?
What family? I have an aging golden retriever.
Answer, Roger.
So, I mean, every situation is going to be different, right? But I'm very fortunate with my family. They're sort of come along. They're happy to come along for the ride. So they've always sort of been part of it. And you saw the picture. They'll, come hear me talk, or I have to go back to the lab one night. Okay, that's fine. Mum's in the lab tonight. I'll get a phone call at 9:30 or 10 o'clock. How's it going? So I just think, every situation is a little bit different, but your family is in it with you.
I would say make sure you have a very supportive partner, and I'll tell you a story. When I was working in Oxford, I was hosting an event at one of the colleges, and I didn't get home till 10 o'clock in the evening, and I had phoned my partner and asked him to pick up our 1.5-year-old son. And when I got home, my husband was lying fast asleep and there was no son at home. And I suddenly said, you were supposed to pick Joshua up. And he said, oh my God, I forgot. And so then we had to phone the childminder, and she said, oh, I just thought you academics, you always forget the simple stuff. So our son, spent the night with his childminder because my husband fell asleep when he got home. So, that has gone down in history.
So the answer is you forget your family, clearly. You have very tolerant partners. My poor wife. I mean, she has come along with me through this. It's interesting, but we also have very good friends. But you do have to balance it. You've got to take breaks and get away from it, and I think that's really important. But because it can be all-consuming.
Question there, and I think Tim, you had a question too.
Yeah. So first of all, thank you all for the speech just now, and I feel like it's very inspiring. The first question is that as clinician scientists, would you sometimes find that your jobs seem to be tiring?
Certainly past my bedtime now. Everything, you get absorbed in and do is tiring. I mean, I've got the chair of pathology and I work half-time at forensics, and I was, I was an editor-in-chief of a journal based in New York for 15 years. So, you learn to get up at 5 in the morning to do work, and it can be tiring. But as I was saying, you've got to take breaks and smell the roses sometimes.
I think for me it's learning how to delegate and knowing what only I can and need to do versus how I mentor and support other people. And again, I would agree with Roger. just surround yourself with people who are better than you, because then that you know that they will do a better job whenever your energy goes, or you have to go home and mow the lawn or whatever.
I wouldn't worry as much as you maybe think you might need to, because as you get older and more seasoned in your career, you learn how to do things more quickly, and you learn which ones are the important things, and you prioritise. So while it may seem that we juggle a lot, we do all still have lives, and we aren't exhausted, and it's something that we've learned as we've, you know, as our careers have evolved. And again, I keep coming back to supervisors and mentors. That's something that they can help you with. So that, you know, you're spending a long time writing a grant, or, you know, your mentor might say, that grant is only going to fund your lab for 1 year, so you should only be putting in a quarter of the time you're spending. Okay. And right, so having people tell you those things as you're learning is very helpful. But you do pick up a lot along the way, and you'd be surprised how much fun we all have apart from our working lives.
I actually lied about the timeline. I'm only 28. It's been a really tough year. You know.
Quick question, because we're starting to run out of time.
So yeah, I'll just go through my second question very quickly. So that's for Justine, and I think it's more about your research. So I'm just wondering if there's a direct relationship between like keeping a cat at home and feeding them with like raw food.
Okay, so yeah,
catching the parasite.
Okay, so maybe you and I can have a chat in the break.
Yeah,
but it's a little, it's not as complicated as that.
Thank you very much, and I think Tim's going to keep his question for the next panel sessions. Yeah, so thank you very much, everybody.